Well, how should I start? Okay, let's get into it. Hello dear doctors, my name is Dr. Shahbaz Ansari and I work as a clinical fellow in North Wales, and here I am yet with another video. I apologize, I've been away for quite a while as I was working on my clinical portfolio because I intend to apply as a surgical trainee hopefully this year, so fingers crossed. Anywho, so I have been wanting to talk about this topic for quite a while. So today I'm going to be talking about 5 common mistakes which are done by doctors during PLAB-2, which actually costs them their exam. And I've had this discussion with a couple of my colleagues who went through this. So I've jotted down this thing and let's begin. Okay, so the first thing would be not knowing the outline of the exam. Most of the students which give the exam are quite unaware or maybe confused in knowing that what is it that the PLAB examiners are actually looking or testing during the scenario. They're not testing your intricate knowledge or complexity of a syndrome or the details of a drug. They're basically trying to check whether are you able to convince or convey along with manage a scenario if it's presented to you up in a clinical setting up to your competency level. You're just supposed to act as a normal junior medical doctor or an emergency doctor in order to manage and contain the scenario, that you're able to take an appropriate history, do an appropriate exam, know which tests or investigations to order in order to get to the conclusion, and have the probable diagnosis or provisional diagnosis, which is your working diagnosis, and you know the ins and out of the probable management, and that's about it. And act as a safe doctor, because whatever diagnosis you're giving in the exam, it's a provisional diagnosis. It needs to be confirmed and a senior needs to look into it in order to rule out if any mistakes are done, and that's how you tell the examiners that I acted to my competency limit and I will liaise with a consultant or with a senior in order to make sure that I've not missed anything, and you've acted as a safe doctor and you're done. And that's basically the outline of the exam. Yeah. And the second thing would be the time management during PLAB-2 exam. And this is by far the most common thing which everyone struggles with. Even I struggled it during my PLAB-2. So basically there are 2 kind of stations which are given to you. One is a history kind of station and the other is management oriented station. In a history station, you have to make the diagnosis and manage the situation accordingly, where the history has got more component into it because you do not have a diagnosis. On the other side, there's a management thing where the diagnosis has already been made and the history is more or less oriented towards management. You just gain the points which is going to help you create a management plan, and the diagnosis will remain more or less the same. So the history needs to be concise there. So but everyone seems to kind of interrelate it or confuse them in between, and they take such an amazing and bulletproof history that by the end of the time then they don't have a lot of time left to manage the condition or give details about the management, and that is where the essence of conversation tends to fade away and it becomes more of a debate, and the doctor is basically trying to blabber and give as much as detail they can in order to portray or in order to shine that I know this and I just want to tell the other person that this and this and that and that, but the patient is not understanding it and basically the conversation is over and now it's a debate. So we need to prevent that from happening and manage time in according manner, that you have got half the time for the history and half the time for the management, so you could make a synchrony between them, that you're not basically hustling over the topic and you remain smooth and calm all over the scenario. Yeah. And the third thing would be not having a roadmap. So this is a very important point, because whenever you're taking a history or whenever you're managing a patient, there is a skeleton to it. There is a roadmap to it which leads you towards the end point, which is the follow-up or the safety netting advice. But if you do not have a roadmap, if you do not have the skeleton on which you're going to base your conversation or your consultation on, it is very likely that either you can deviate yourself from the path, or the patient can give you excessive and extra information which is going to confuse you. Okay, do I need to address this, or do I need to address that? So that's the thing, you need to filter out the unnecessary stuff and stick to a pre-made plan so you can get through the conversation and being on a time constraint limit as well. So this is something you need to master and practice, and what works for me might not work for you. So you have to come up with a plan on your own and stick to it religiously. Yeah. And the fourth thing would be excessive use of different notes, going to different academies, giving yourself too much time. This is something which depends upon an individual level, because I believe the more you practice, the more you get confused, because it's not about the practice. If you practice the correct manner, you can ace the exam within 15 days. And this is not just me blabbering hypothetical stuff. I've actually met people in the academy. When I gave my exam, they had just come for 15 days, gave the exam and cleared with flying colors. Whereas on the other side, there were people who came 3 months before the exam, took multiple academies, but their practice style, they had some mistakes which were not being corrected, so they kept on practicing in the wrong manner, and which costed them the exam. So practice efficiently and try to know yourself what are the things which are your weak points, because your weak points might be someone else's strength, and someone else's strength might be your weakness. So you need to practice in an efficient manner. Yeah. And the final thing would be, yeah, it's related to the fourth thing, is practicing with different people, try to come out of your comfort zone. Because if you are practicing with one person every day, doesn't matter, you have practiced 100 cases, 200 cases, but you're practicing with the same partners, 1 or 2, so you're basically going to get comfortable with the conversation, and the element of surprise that is not there basically. And you are expected to have 16 different people in the exam, and you'll have 16 different conversation. So you're not used to that level of discomfort or variety. So try to change your partners, try to practice with different people, and try to come out of your comfort zone. Okay. And just the final thing to sum it up, what you need to wear in the exam is your confidence, because by the end of the day, I know it's hard to believe, but honestly, everyone wants to pass you. Even in the exam, when I went to give my PLAB-2, there was a really sweet doctor. She was a GP who was one of the examiners. So she said that, believe in us, we want you to clear the exam, because UK is in dire need of doctors. Unless you make a lot of mistakes, it's very likely you'll clear. So yeah, that's about it, and best of luck for your exam. I hope this is a very short video which might be helpful for you. So please drop in your likes and comments or compliments if there's something you like, and advise me on what topics you want me to shed light upon, and I hope to bring on new content to you. See you later.